Hi everybody, Dr. Britt Talley Daniel MD, and I'm a neurologist and headache doctor. I have a big migraine blog up at www.drmigraine.com, in which I have over 100 articles written on migraine, which might be helpful to anyone suffering from migraine to read. And the article I'm going to talk about today, which is Does Emgality Work for Cluster Headache, is on there too. I'm just going to talk about it today. And I also have on Amazon a big, large textbook on migraine, which is like 400 pages with 900 references, and a smaller book on migraine that you can get as a print book or an ebook. Okay, so today, does Emgality, which is one of the new CGRP injection drugs, which is approved for treating migraine in the fall of 2018, does it work for cluster headaches? Well, I want to talk about cluster classification just for a minute so you can hear some of this. In the 60s, when I was in medical school, they published the first classification of headache, which I was referring to at that time. It was in the JAMA. It was 1962, and that article was published. Had at the top of the headline, they had migraine, and underneath it had different kinds of migraine, like common migraine, classical migraine, hemiplegic migraine, and then cluster headache was at the bottom. So cluster headache in that classification was considered to be a type of migraine, but now we're in the International Classification of Headache Disorders in the third edition of that, and they classify cluster headache as a trigeminal autonomic cephalgia. So it's a little different from migraine. So back to the question, does Emgality work for cluster headaches? Well, the FDA has approved Emgality as the first ever treatment for episodic cluster headache in adults. It reduces the frequency of attacks. All right, this approval comes after a clinical trial comparing Emgality to placebo, showing that patients taking Emgality experienced 8.7 fewer cluster headache attacks than patients taking placebo after 3 weeks. Good. So all your cluster headache patients that have new preventive drugs. Well, there's similarities and differences between cluster headache and migraine. Both migraine and cluster headache will have a normal neurologic exam, except patients who've had chronic cluster headache for years, and some of those folks will have permanent ptosis, where their lid will drop down a little bit, and then they have a small pupil, which is called myositis, on the side of the headache. The head, they usually get cluster headache. That's a Horner syndrome. It can rarely be seen in patients with cluster headache. Otherwise, the exam neurologically is normal. What's the clinical occurrence of headaches? Well, migraine, what's called episodic migraine, which means 14 headache days a month or less. That can be the episodic migraine can only occur about twice a week, because if it's more than that, like 3 times a week, you're going into what's called chronic migraine, which is defined as 15 headache days a month, excuse me, 8 of which have migraine features. Whereas cluster headache comes and it lasts usually 6 weeks. It can go from a range of 3 months to a year to a month and a half, but usually it's about 6 weeks. Cluster headaches come on without warning and reach a peak within 2 to 15 minutes. It's a very quick onset headache, whereas migraine headache can come on lasting, it can be very quick also, but it usually comes on lasting 30 minutes, over 30 minutes, and it can take 1 or 2 hours to get to the peak with nausea, vomiting, sensitivity to light. So cluster headaches are very severe, quick onset, one-sided headaches, which have pain around the eye, the temple, and the cheek only. Yeah. Migraine can have pain in the back of the neck and also can come in the sinus areas. But cluster headache is around the eye or above the eye. Also, cluster headaches can come at the same time every day. And they usually like to come 1 or 2 hours after you go to sleep at night. So they'll come then every morning, like at 1 in the morning, I have a headache every morning, wake up at 1 in the morning, and they come at 10 in the morning. Whereas migraine doesn't typically rotate to the clock in the same way. The duration of headaches, of cluster headaches, is 15 to 180 minutes, with most cases lasting about 30 minutes. And the attacks may occur 1 to 8 times a day, whereas migraine can last 4 to 72 hours. So what's this about the cluster headache? Why do they call it cluster headache? Well, they cluster in time. Like the patient may say something like this: in March of 2017, I had 2 or 3 headaches every day for 6 weeks. Always on the right side, always lasting a short period of time, always kind of locking into the clock. All right? And so that's why the headaches cluster in time like that. Then the next year, 2018, I didn't have any headaches at all. And then now this year, I've started headaches again about a month ago. Cluster headaches may come in the spring and the fall also. There may be some occurrence in February and June. At the time of the year, there was an increase in daylight. I don't think that's well understood. Cluster headaches are usually strictly one-sided. And only 50% of patients will switch sides during an attack. So if you start with the right-sided cluster, only 50% of patients will switch to the left side. And most of the time they'll stay on one side. That's pretty typical of it. Well, what's the response to triptans? Triptans are these drugs that are acute therapy drugs for treating migraine, and there's one injectable kind, which is sumatriptan. The others are nasal spray or oral pills, and there's 7 of them. And so the triptans that are used for treating migraine, because you need something quick, are injectable Imitrex or sumatriptan, 6 milligrams, which works in about 10 minutes. It gives a really good high dose of medicine. It's probably the best drug for treating cluster headache acutely. Or you can take the 25 milligram nasal spray, which of sumatriptan works in about 10 minutes, or zomatriptan 5 milligram nasal spray works in about 10 minutes. The problem here is that the FDA has only approved triptans for treating migraine, and there's no approval out there for cluster headache. So cluster headache patients are left out alone in the desert. And since they may have headaches 2 to 3 times, they can have them up to 8 times a day for 6 weeks. And the insurance only gives 9 pills or shots per month for migraine. You can see how quickly the patient with cluster will go through their treatments. So the idea of having a preventive drug is a great new resource idea. Also, cluster headaches may respond to oxygen therapy, where they have a mask over their face and they breathe them. Now, for cluster headache, Emgality is given as a pre-filled syringe, which has 100 milligrams. You have to take 3 of them each month. And those are given in the anterior thigh or around the belly button, around 2 inches, in the same way that diabetics use or take insulin. What are the side effects and warnings of the drug? Well, some patients very rarely are allergic to it, and they get skin rash, hives, trouble breathing. They shouldn't ever take it again. The most common possible side effect is what's called an injection site reaction. It's a tiny little bruise, like one gets when you go to the lab and have your blood drawn in your arm for your doctor, and it's no big deal. It goes away in a couple of days. Used with other drugs. This is where the CGRP drugs like Emgality are so remarkable. They have no side effect with any other drug. I've been practicing medicine nearly 50 years. I've never had a drug where it didn't have any side effects from the other drug. A common drug like penicillin as an antibiotic has 10 drugs that you can't take with it. But these new drugs don't have any other side effects. You can take it with any, they can take it with any other drug. That's really amazing. I want to list the specific cluster symptoms that may come in addition to headache. You can get conjunctival injection. It means the white part of the eye turns red. That's usually on one side. Let's just say the patient's having a right-sided cluster headache. They may have lacrimation. Well, that means the right eye tears. They may have nasal congestion. That means the right side of the nose stops up. There may be rhinorrhea, and that means the right side of the nose drips clear fluid. There may be forehead and facial sweating. That means on the right side it sweats. Or there may be meiosis, which means a small pupil, which is going to be on the cluster side, let's say the right side. Or the eyelid may droop, which is called ptosis. Or there may be swelling or edema around the eyelid. I want to spend a minute just on the pain description of cluster headache also. It's called killer headache or suicide headache, and the pain is reported by patients as being boring, stabbing, burning, like a knife, like a hot poker in the eye. And at the end of the attack, symptoms go away within 1 to 2 minutes. Now, these drugs, Emgality has a contraindication. They are not approved for taking for ladies who are pregnant or breastfeeding. So, this is the end of my talk on does Emgality work for cluster headache? And God bless all you stricken cluster headache patients. Hope you get this medicine. Your insurance will cover it and your doctors will give it to you. Good luck to you all. God bless you. I'll see you on the next talk.